You have dizziness, vertigo, you're unbalanced, maybe you suffer from Meniere's disease, tinnitus, or some other balance disorder, and is affecting your quality of life. Hopefully, you're treating the cause of your problem with your healthcare provider. However, you might be eating foods that are exacerbating or making your problem worse. In this video, I'm going to give you 5 foods that you might be consuming that's making your condition worse. If you can reduce or eliminate one or more of these foods, your body will heal better, you'll feel better, and you'll be on your way to getting your quality of life back. Let's get to it. My name is Dr. John Saunders. I've been treating patients for over 21 years in clinical practice with dizziness, vertigo, cervicogenic dizziness, Meniere's disease, tinnitus, and a host of other balance disorders. One thing is certain, what you consume will dictate how well you heal, feel, and function, and it can determine how much dizziness or vertigo or unbalance you will feel on a day-to-day basis. We're going to get right to it. I'm going to show you my top 5 foods that you need to reduce or eliminate for you to feel better. The first one we're going to discuss is salty foods, or foods that have salt or sodium added to them. High sodium diets can cause fluid retention that can affect your inner ear, worsening symptoms of dizziness or vertigo. As well, foods with high salt content can also affect our blood pressure. Fluctuation in your blood pressure can affect your inner ear and your balance centers, making dizziness or vertigo worse. As well, high blood pressure over a period of time can damage these small blood vessels in your inner ear. Left untreated over time, it can worsen your symptoms of dizziness, vertigo, it can increase your tinnitus, and even worsen symptoms of Meniere's disease. Over time, it can also cause hearing loss. Reducing your sodium intake is difficult. It's hidden in so many foods, and you have to start to read labels. Many processed foods, canned goods, boxed goods like crackers, all of these things contain high amounts of sodium. So it's imperative you're tracking the amount you're taking in on a day-to-day basis. A good place to start would be a teaspoon or less of sodium per day. That equates to about 2,000 milligrams. Another thing that can go a long way in helping is making sure you're well hydrated. Let's start to reduce your salt so your dizziness and balance can improve. Number 2 is caffeine. Caffeine acts as a diuretic. It dehydrates our body, changing the fluid volume in our body. This can cause lightheadedness in most people. Dehydration can also cause an electrolyte imbalance in our body. This can bring on episodes of dizziness, vertigo, and it can also cause spatial orientation issues. As well, we know caffeine is a stimulant. It increases neural activity. This in itself can cause dizziness and lightheadedness amongst many other things. It's just best to reduce the caffeine in our lives. How do you do that? Well, we reduce it by the things we consume. One of the obvious ways to reduce our caffeine intake would be through coffee and tea. Sub out your teas for a more herbal tea. It is also found in chocolate and those energy drinks. If you're drinking those energy drinks, get rid of them. They're so unhealthy on so many levels. That's another video in the future, but they are packed full of caffeine. Reduce your caffeine intake and you'll have less episodes of dizziness and vertigo. Number 3. High sugar foods. As we know, high sugary foods will raise our blood sugar really high, and insulin will spike. It will pull sugar back into the cells and we'll have this crash. This can lead to dizziness, vertigo, and an unbalanced feeling. As well, if you're consuming sugar over a long period of time, it creates inflammation in your body. Basically what's happening is you develop insulin resistance, and insulin resistance is whereby the sugar is unable to be transported into the cells and it keeps your blood sugar high. This can affect your brain and balance centers in your brain as well as your inner ear, resulting in dizziness, unbalanced, and vertigo-like feelings. One thing you need to know for certain is what your blood sugar levels are and whether they're healthy or not. This is something you should discuss with your doctor to make sure you're not either pre-diabetic or a full-on diabetic or type 2 diabetic. If you are pre-diabetic or have type 2 diabetes, you have to control your blood sugar for you to feel stable on your feet. It will reduce your dizziness and vertigo spells significantly. There are many things that a high sugar diet does to our body. We know it promotes systemic inflammation. Systemic inflammation is where inflammation is high everywhere. So if you have a balance disorder or an inner ear problem or a balance problem in your brain, it's going to exacerbate or make that worse. A high sugar diet will also cause a response to your adrenals. This is where stress hormones are released in your body, and it can give you that shaky feeling, the sweating, the dizziness, the unbalanced. So reducing your sugar will go a long way in you feeling better. Some places to start to reduce your sugar intake would be desserts and sugary snacks. Many of the snacks that you think might be healthy, like granola bars and yogurt, are packed full of sugar. So you need to start to reduce or eliminate those. Another hidden form of sugar that we don't often think about is in our beverages. Our beverages like juices, orange juice, apple juice, things that you might think are healthy, again, are loaded with sugar. An easy switch would be switching out those sugary beverages for more healthy ones like water, herbal teas, and such. So if you have one action step now, switch out your beverages and start to reduce your sugar. Number 4, we have dairy products, specifically milk products. And it doesn't matter if it's cow's milk, sheep's milk, goat's milk. They all have proteins in it that can create immune responses in our body. There's a reaction between the milk proteins and antibodies. The antibodies cause our immune cells, particularly our mast cells and our basophils, to release histamine and other inflammatory markers in our blood. This in turn causes systemic inflammation. So if you are suffering from an inner ear issue or a balance center issue or cervicogenic dizziness in your neck, you're increasing your inflammation and it's exacerbating those conditions. So we want to try to reduce or eliminate that dairy or milk products. Also, as an aside, some of these foods like old cheeses contain things called tyramine. Tyramines can affect your blood pressure, resulting in dizziness or lightheadedness. So we want to reduce those foods that have high tyramines like old cheeses, cured meats, and certain fermented foods. The best way to do this is to either eliminate or reduce or find an alternative to the dairy or milk products that you're currently using. Number 5 is gluten. We've all heard about gluten. If you've been diagnosed with celiac disease, you're already aware of the ramifications that gluten can have in your life. But what about non-celiac gluten sensitivity? This affects many people, if not everyone. Non-celiac gluten sensitivity is whereby our small intestine gets irritated by the gluten protein. What happens is that gluten damages the lining of the small intestine. This allows things to escape. We call this leaky gut or leaky gut syndrome. The problem being it allows things to escape that shouldn't, and this creates an immune response within the body that causes systemic inflammation. Systemic inflammation is not good for anyone, but specifically those with dizziness or balance disorders, it really can wreak havoc and exacerbate or make those conditions worse. Systemic inflammation affects the balance centers in the brain and the inner ear. Another thing that gluten does, because it can affect the lining of the intestine, it basically robs our body's ability to absorb certain nutrients. We can become nutrient deficient in vitamin B12, folate, magnesium, and potassium, all of which can cause dizziness or vertigo attacks. At the very least, we need to try to reduce our gluten intake or eliminate, which is not an easy task. So when you start to look at what you're consuming on a day-to-day basis or looking down at a plate, I want you to think, is there high salt content in it? Is there caffeine in it? How about your sugar levels? What does it look like in that type of food? Is there milk products or specifically cows, goats, or sheep's milk that have high milk proteins? Is there gluten? Do you eat a lot of gluten on a day-to-day basis? If the answer is yes to any of those things, then what we want to do is first attempt to reduce. There's 2 types of people. One that can go cold turkey, just make a decision and do it, and others, more like myself, that might take some reducing and some time to achieve that. It doesn't matter which one you are, just make the decision today. I assure you, if you are able to do this, your dizziness, your balance disorders, they will improve as your inflammation comes down. I hope you like this video. If you do, show some support by giving me a thumbs up. And if you're new to my channel, maybe you'll consider subscribing so you can be informed when I upload a new video. Be sure to check my channel. I have all kinds of videos on dizziness from the neck, from the inner ear, things that are going to help you help yourself at home. I can't wait to see you in my next video. Until then, stay well.